Hello, assalamu alaikum. My name is Dr. Faraz Ahmed, and today in this video we are going to discuss test for nurses. Okay, so let's move forward. So before we proceed to the video, I would like to tell you something about OET by Dr. Faraz Ahmed. So we are providing personal one-to-one classes for writing and speaking subtest. We also provide letter evaluation services and speaking sessions as well. So to get enrolled for writing evaluation and for speaking evaluation, you can text us on our Facebook group OET by Dr. Faraz Ahmed. You can join this group and you can text us there. You can email us on drfarazahmed137@gmail.com. You can text us on Instagram on Dr. Faraz Ahmed Chaudhry, and you can also subscribe our YouTube channel Dr. Faraz Ahmed. This is very beneficial for you. There are a lot of material there. I have uploaded 4 to 5 videos for writing, that is video on referral letter, video on transfer letter, video on discharge letter are there, and you can also find 12 listening subtests there for your practices, and you can also find videos for listening and reading tips, all of the part A, part B and part C. So do visit this channel and please subscribe it. Okay, so let's move. So this is our case note for today's video. We will shortly read this case note, and we will also discuss the important points from the case note as well. So before we read the case note, I would like to tell you tips for letter writing. So first of all, you have to search for type of letter. Once you have searched for type of letter, then we will move for the purpose of letter. So for example, we have searched that it's a discharge letter, then we will search for what is purpose of this letter. Then after keeping the type of letter and purpose of letter in your mind, we will mark relevant information from the case note. Okay, we will search for purpose, for diagnosis, for procedure in our case note, and then we will mark the relevant information which are only relevant to the diagnosis or procedure given in the case note. Then we will include the information in our letter. Okay, so today's letter is basically a discharge letter. I would like to tell you some basic steps how to write a discharge letter. So in first paragraph, after mentioning of the address, in first paragraph we will definitely write introduction of the letter. Okay, then keep in mind we have to do nothing with social history, past medical history, past surgical history, family history. We have to do nothing with these histories in discharge letter. So in short, we will skip this paragraph in discharge letter. So second paragraph would be presentation. If there is any procedure and any diagnosis given in the case note, we will mention about that diagnosis, about that presentation, about that procedure, and then we will mention only relevant things from the hospitalization, like which procedure was done, what was post-operative care, what was nursing care, like what was the diagnosis, what was hospitalization status, which tests were done, and which medication were prescribed, and what nursing care was given. So in third paragraph we will write about today's assessment. After writing the today's assessment, then we will write conclusive paragraph. So keeping in mind these 4 steps, we will write about discharge letter. So let's move to the case note, and now we will mark the only relevant information which we have to write in our letter. So let's go there, and now I will tell you that how we will scan the case note. Let's move. Okay guys, so guys, this is our case note. Now I will tell you that how we will include the relevant information from the case note in our letter. So first of all, what we will do, we will search for type of letter. So directly move to the writing task, and we will see there that which type of letter this is. So it's written that using the information in the case note, write a letter. So nothing is mentioned here. They are mentioning that just write a letter. So we will directly move just above the writing task. We will see there, here it's clearly written that discharge plan. It's a discharge letter. And what is discharge plan? We will write about the monitoring of the medication, preservation of skin integrity, and we will also write about the continue the exercise program. So these are three discharge plan. Number one, monitoring of medication, skin integrity, and exercise continuation. Then there is something else which is written in the discharge plan, that is equipment required, that is wheel walker, wedge pillow, and toilet tracer. Hospital to provide the walker and pillow. Hospital social worker organized 2-week hire of the razor from the local medical supplier. So guys, after reading this paragraph, we have clear idea that this is a discharge letter, and we have also read the discharge plan as well. So after discovering that this is a discharge letter, now we will directly move to start of the case note. We will see that what happened to the patient, that after what patient is getting discharged from the hospital. So let's move to the start of case note now. Okay guys, so this is our case note, and now we will discuss about okay guys, so this is our case note. Now we will mark the things which we are going to write in our letter. So what is the date of today's date? Today's date is 7 September 2018. We will write this date in address of our letter. Our patient is Mr. Gerald Baker, 79 year of age. Okay, and then we will write some patient details. Marital status is included in social paragraph. Social history, we will not write this. Admission date, we will write this. We will write this admission date, we can write, and discharge right is same as the today's date. Okay, so now what was the reason for patient admission? Patient get admitted patient get admitted on 3rd September, and on 4th September patient underwent left total hip replacement. This is very important point. So now after keeping this thing in our mind, we will scan the letter for the relevant information which we are going to write in our letter. So on 4th September patient underwent left total hip replacement, and social background, we will simply cross this paragraph as this is a discharge letter, and we will write nothing from this paragraph. Okay, so let's move forward. So here is the medical background. We will not write anything from this paragraph as well, because this is also included in social history paragraph. I have told you that nothing to include from medical background, from social background, from surgical background, from personal history in discharge letter. Okay, so after the operation on 4th September, which medications were given? This is very important. We will include this information in the second paragraph of our letter. Aspirin was given, that's good, that was given post operatively. Ramipril was given, and Panidine 4 was given. Okay, so if you read the medical background, you can check that hypertension, and patient is ongoing medication. So patient is taking Ramipril for hypertension. Okay, this is ACE inhibitors, and patient we recommended aspirin and Panidine 4 for pain relief after the operation. Okay, so nursing management, I have told you that this is again very important. We will also write about the nursing management. What was focused? Nursing management was focused for what? Daily dressing. Okay, and they were also focused for range of motions including stretching and strengthening exercises. That's right. And nursing management was also focused for occupational therapy as well. So guys, these two lines which are given at the end of nursing management paragraph, we will now read these. So staples to be removed in 2 weeks on 21st September. So and follow up blood test. So staples removal and the follow up blood test, basically we will write these two things in our conclusive paragraph. We will mention there about the follow up visit. Okay, so we will not write in second paragraph these findings. Okay, then we will write these assessment in today's history paragraph. So let's move that what is today's assessment. So today's assessment, patient has good mobility on today assessment. weight bearing with use of wheelchair, that's really good. Patient is also bearing the weight with wheel walkers use, and patient is walking length of the ward without any difficulty. So this is our today's assessment, and we will write this in our third paragraph. Okay, so again these findings are, we are going to write these findings in our second paragraph, because they are post-operative finding. Here is clearly written that post-operative disorientation with time and place during the recovery, this may be related to anesthesia. So post-operative disorientation was there, and we suspect that this is related to anesthesia. So we continued patient observation. Okay, so post-operatively there was also anemia. His HB was 72 gram per deciliter, requiring 3 units of the blood packed at cell transfusion, and as a result his HB was 112. Okay, so discharge. In discharge we are going to write the following recommendations, like monitor the medication, preserve the skin integrity, and continue the exercises, because now disorientation is resolved, anemia is resolved, and pain is resolved. So we will monitor some medication like Panadine 4 for rest of the pain, and some other medication like Ramipril for hypertension, skin integrity, and continuation of exercise program. So guys, now keeping in view these findings, these information which we have just underlined, now we will write our letter. Okay, so let's do it now. Okay guys, so let's move to the letter now. So this is our today's date which is given in the letter. So here we have written our address, Miss Samantha Bruin, senior nurse, Graywell Nursing Home, Graywell, Mr. Gerard Baker, aged 79, and dear Mr. Bruin. So this is our address. We will write our address in this way, and now let's move to the introductory paragraph. So here is our first paragraph, introductory paragraph. What was the purpose of letter? We are going to discharge our patient after what? After left total hip replacement. So we will write it. So basically discharge letter is an update letter. So we are writing that I am writing to update you regarding Mr. Baker, who is being discharged today after a left total hip replacement. So we will also write the current status in just a single line in the introductory paragraph as well. We will write that now he is stable and needs your future care. So in this way we will write the introductory paragraph of this letter. Okay guys, so in second paragraph I have told you that we will write in detail about the hospitalization, which was diagnosis, and what procedure was done, and what medications were given, what was nursing care. So everything we will include in this paragraph, which is the second paragraph, the most important paragraph in the discharge letter. So we have written that Mr. Baker underwent the surgery. I am sorry, here it would be THE, not A. Underwent the surgery. It's mean we have mentioned about the surgery, that was left total hip replacement in the introductory paragraph. So we have used article the here, and we have just mentioned underwent the surgery on this date. Okay, then we are writing about post-operative status. Post-operatively, aspirin and Panadine 4 were commenced for what? For pain relief. Okay, in addition to his ongoing antihypertensive medication, that was Ramipril. So post-operatively we give aspirin and Panadine 4 in addition to Ramipril for his hypertension. Additionally, there was post-operative anemia as well, which was managed with blood transfusion, and after transfusion his HB was 112. And in addition, he was observed for post-operative anesthesia related disorientation as well. So these were the three basic complaints, like pain, disorientation, and anemia. So we have mentioned about pain, we have mentioned about anemia, and we have mentioned about disorientation as well. So in this way we will write about the complaints after the procedure, that was pain, anemia, and disorientation, and their management. So I have told you that we will also write about the nursing assessment, nursing management. So we have written here that during hospitalization, nursing care was focused on daily dressing. I have mentioned this earlier there, and range of motion, including the stretching and strengthening exercises, in addition to occupational therapy. So basically these three were the nursing management: daily wound dressing, range of motion, and occupational therapy were the nursing management. So now we have mentioned about the procedure in the second paragraph, we have mentioned about post-operative complaints and their treatment, we have mentioned about nursing care. So in this way we will write our second paragraph in the discharge letter. Okay, so let's move forward. And then I told you that in third paragraph we will write about today's assessment. So what was today's assessment? I have told you, I have underlined, I have marked in the case note that on today's assessment Mr. Becker has good mobility and can walk along the ward using a wheelchair without any difficulty. Okay, so this was today's assessment. His mobility was amazing, mobility was good, and he was able to walk along the ward without any difficulty. So we have mentioned these two findings which were there on today's assessment in third paragraph of the discharge letter. So let's move to the last paragraph. So this is our conclusive paragraph, fourth paragraph of our discharge letter. So what was the conclusion? I have told you that we are discharging the patient and he is being provided three things about like walker, wedge pillow and toilet razor, and we have also provided some recommendation related to medication, skin integrity and exercise as well. These things were given in the discharge plan in the case note. So I have told you there that we will also write about the follow-up visit in the case conclusive paragraph as well. So let me tell you now that how we have written this conclusive paragraph. I have written that in light of the above, Mr. Baker is being discharged into your care, that's fine, and is provided with what? Provided with a walker, a wedge pillow and a toilet razor. Okay, so we have to include these three information in our conclusive paragraph as well. So your care related to his medication, your care related to his skin integrity, related to exercise program would be greatly appreciated. So these three are the discharge recommendations. And there is another important thing which we have to mention as well about the follow-up visit. So I have written this with, please note, a follow-up visit is scheduled after 2 weeks for what? For removal of his staples and for blood tests. So guys, in this way I have included all the relevant information in introductory paragraph, in second paragraph, in today's assessment paragraph, and in fourth paragraph, that is conclusive paragraph. So in this way you have to include all the relevant information related to diagnosis and related to procedure. So this is the end of the letter. We will end every letter with this line: should there be any queries, please do not hesitate to contact me. Yours sincerely. Leave 2 spaces here and then we will write charge nurse. Put a full stop after charge nurse here. Okay, so guys, this is our today's discharge letter. Keep in mind our word count for this letter is 178. So this word count is really amazing. If you are going to write your letter within 200 words, definitely you will score very good marks and you can easily clear the writing exam. So guys, please follow these guidelines and please share this video to other nurses as well, as I was receiving a lot of requests for writing subtests for nurses and follow the tips of the discharge letter writing. So I hope you will definitely inshallah pass your exam. So thank you very much for watching this video and please subscribe to my channel as well. Bye bye. Allah Hafiz.